Hi, everybody, and welcome to Lyfebulb Live. Today we have on Miss Teresa, and Teresa is one of our amazing ambassadors that advocates both in MS and heart disease. Teresa, I'm so proud to have you here. You are one of my go-tos. I think that you
Mhm.
are fantastic. I love the way you eloquently put things in both poetry and in speaking, and I'm super excited to have a conversation about healthcare inequality and equity. Like, what are we doing here? We need more for our patients. So, Teresa, thank you so much. Would you like to give everybody a little background about yourself?
Sure, Annmarie. First of all, I'd like to thank you and Karen and the Lifebulb team for having me and for having this conversation. I am Teresa Wright-Johnson. As was already said, I'm a heart health advocate and a multiple sclerosis advocate. I have chronic pain and I believe in diversity and inclusion and health equity. These are things that I'm very passionate about. These are things that my platform discusses and talks about because I believe that when we band together and when we address issues and when we address illnesses and when we come together as one, I believe that we create massive change that way. So, I mean, that's it about my life. I really believe that I am designed to be here. I don't plan to just exist quietly. The world has to know I was here, and not so much because of me, but for all those who will come after me, for those who haven't found their voice yet, for those who may not want to step out front, for those who may have lost their way. I just think that life is about what we create and the legacy we leave. And because of organizations like this and so many other organizations that I'm so proud to work with, I am allowed to do this work for the betterment of myself and for humanity.
I loved everything that you said, and I totally agree. Like, this is why we're here. It's not just about us and what we've gone through, but it's about future people who can't always speak up for themselves, or that
Right,
person who is going through it right now so that they can see that we are not alone.
right.
I did find a little quote that I think is kind of embodies what we're talking about today, and it says, we put it in the comments there. Equality simply means everyone is treated the same way, regardless of the need or any other individual difference. Equity, on the other hand, means that everyone is provided with what they need to succeed. And that is the difference. So many people in our world are not provided with the things that they need to thrive and succeed through their diagnosis. And this goes it goes beyond race, it goes beyond ethnicity, it goes to gender, it goes to age, it goes to all of those things. I've gone to the doctors with my father at 84 years old, and he's treated like a child. He is a smart man, and me, I've gone to the doctors and as a woman have been treated like I'm whining or complaining. These are the things that do not give us equity or equality.
Absolutely. You could not have said it better. We Fortunately for us, fortunately and way overdue, we have entered, I like to call it a movement now, where patients are asserting their voice, people are asserting their voices, because we matter, our voices matter, our care matters, the quality of care matters. And just as you said, it does, it encompasses age and race and gender and sexual identity. Like it encompasses so much. And
Mhm.
until we break down these barriers and until we give this a voice and until we have conversations like this, we cannot begin to combat it. This is a work that has to be ongoing. This work will be ongoing.
For
And if
sure.
you, for sure, and if you look at the different movements and the history in our country, this work has been ongoing. We don't arrive. We have to keep fighting for our rights. We have to keep asserting our rights because the bottom line is this. if you don't have proper health care and if you don't have access to health care, then how can you live a certain quality of life? You know, you are being denied a certain quality of life that, as you said so eloquently in that definition, health equity and equality is very different. And I
Right.
think that we have to have both.
100%. And it's not, as you were talking, I was thinking about how, my kids, when I take them to their physical, I've had their doctor say to me, gosh, I'm so impressed with how they just speak up for themselves and they kind of, give us their with what's going on with them. And I said, well, they have to, because they have to learn how to do that to
Right,
succeed in their own health as
right,
adults. And I do think it starts that young. Like your kids, I don't care how little they are, they can tell the doctor, I have a boo-boo on my finger and I need to la 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 la. Because when they're older, that teaches them to advocate for themselves. And
absolutely.
another part, and I really want to preface this in this conversation, when we are talking about equality and equity in healthcare, this is not just physical health, this is mental health, and
Absolutely.
both need to be even. I would love to see this conversation change to just healthcare. I don't have to say it's mental health. I don't have to say it's physical health, because it's all just healthcare, but we're not there yet. We are not there yet.
It is. You put this out in the atmosphere, and I want to address it. I identify myself as a seasoned patient because, of course, as you know, I grew up with illness. I was born with a diagnosis. So, you know, this advocacy platform and advocating for myself and advocating for my needs, this more or less was a learned behavior. And that's why we have to teach children young. You know, my parents and my mother, especially, when we would go to a doctor appointment, my mother would ask, well, how do you feel? What are your thoughts? You know, you have to build that environment where children know that they can speak up and they can speak out. And we
100%.
also have to foster relationships with medical professionals, with our healthcare providers, that not so much that there's this great divide, because in my eyes, there isn't this great divide. Like, you're not here and I'm not here. We're on equal levels.
Right.
We're partners in my care. And if you can't take what I'm saying, and if you can't treat me as the entire person and treat my humanity and treat everything that comes with me, and that's my race, my gender, my orientation, my history, if you can't compile all of that, then you're not really working in my best interest, because the only way we can reach where we're trying to go is when A, we have these discussions, right? B, when we foster a relationship with our medical providers. C, when we examine ourselves. You know, we always hear now about implicit bias and systemic bias. We hear about that, and it's not an illusion, it's true. And until we can address those things and bring them front and center and talk them out and talk about them, and until we are, you know, in medical schools talking about this, talking to students, putting patients forward so they can share their experiences and they can enlighten the entire healthcare spectrum. Until we do these things, I think we're going to always face these issues that we have before us now.
I just love what you just said, because it's 100% true. And you are right about all of those different levels. It's not just about those doctors too. I think you were part of one of the workshops that we have. And, part of Lyfebulb's mission is to bridge that gap between the patient
Yes,
and the big company, whether it's a pharmaceutical, an
yes,
insurance, or a bigger corporation, to listen to the unmet needs of the patient. And that to me is the sheer definition of equality and equity. When we address the unmet needs that the patients are having, and we actually provide a solution for them, then we have equality and we have equity. Everyone is balanced because we have these great solutions that somebody can, be part of. I
absolutely.
think that we need to listen more. Providers need to listen more. I had a good friend of mine, Mema is her name. She owns a beautiful nonprofit called Tiger Lily it's a breast cancer organization. And she talks
Mm.
about, yes, she talks about, the inequality and
Mhm.
the inequity in the African American community based on the fact that sometimes your doctor doesn't understand your background because of your race or your ethnicity. And I actually understand that I may not be of color, but I do come from a very strong line of Italian culture, and that adds to my health. Do you know what I'm saying by that? I think that and it's not,
Exactly.
to me, when we say, African American women, and it is Breast Cancer Awareness Month, but African American women are more likely to be diagnosed late in stage with breast cancer. That doesn't have to do with education. That doesn't have to do with awareness. It has to do with equality and equity. That's what it has to do with. They're not provided with the same tools and solutions
Exactly.
that the average person is.
So I totally agree with that. And I just also want to make this point. When you look at diagnoses, when you look at treatment plans, when you look at um, long term outcomes, uh, Black and Brown people are behind. And
Mm-hmm.
just as you spoke, it's because of these barriers to care and access to care and lack of access to care. And again, the elephant in the room is always the bias. I recently had the experience of speaking to some medical students. They were studying to be physician assistants. And my first question was, will you help or harm?
Mm-hmm.
Because sometimes, our words and our beliefs, they have the capacity to harm another. And it's not always intentional. Sometimes it's what do we say? Sometimes it's implicit. But
Yeah.
if I have this view of a certain group, or if I don't value the life of a certain group, or if I just have these beliefs about a certain group, then my care and my delivery of care may be different. So, I mean, these are all of
Yeah.
the things that we have to address. And who better to address these issues with by those in these various communities? Who better, as you said, to address these issues by other than people with illnesses and people who know what they deal with and people with these unmet needs. This is just so crucial. And again, I'm only speaking from my patient perspective. I'm only speaking of things that I've seen in
Of
my
course.
care. And I like you said with your dad, my parents are elderly. There were times that I had to stand front and center on behalf of my mom because
Mhm.
sometimes there's just this belief that because they're older they can't emote the same or
And just like with younger people too, right? It's if you're too old, so you don't have your clarity. You're too young, so you don't understand. There is one thing while you were talking, I wanted to pull the exact number up, and I will share it. But African American, because it is Breast Cancer Awareness Month, and to me, Awareness Month means education. It does. I don't tell me that I need a mammogram. I understand that. It doesn't. I don't care what the illness month is. Educate me. Tell me real facts. And African American women have a 31% breast cancer mortality rate, a highest of any US racial or ethnic group. That is a big number, 31%. This is about equality and equity. This is not about, don't tell me education or poor economic status. I don't want to hear any of that. That's not what it is. It's providing the tools needed to succeed, and we are not doing that.
right. I came across and I can't locate it right now, but I was reading. I can't remember the percentage, but it stated that the likelihood of a person of color walking out of a healthcare provider's office without a follow-up appointment is exceedingly high.
Wow.
So, when you take all of those things into consideration and you look at these statistics and you look at the social determinants of health and you realize that healthcare healthcare is huge, and healthcare affects every other aspect of life. If you're not in good health, how can you make an economic how could
How
you be
can you work?
financially,
How can you take care of your kids?
exactly. If you don't have, if your health is bad and you don't have stable housing, or if you don't, it's like all of these things are interconnected. And until we realize and recognize that all of these factors are interconnected, these conversations are not, they're not easy to have. A
No,
lot of people don't want to have them, but they are needed. And the agencies and the companies and the providers that are willing to have these conversations are invested in their patients and in their communities. And that's what makes the difference.
for
What makes
sure.
the difference for me, as a patient, is honesty, authenticity, you caring about me and my well-being in all aspects, that you're not just dismissing what I'm telling you. That if I tell you I'm in pain, you're not telling me that I'm stressed out and you're just going to write me a prescription and tell me to go home. It's that you listen to me and that we devise a healthcare plan together.
I
That
love this.
matters. And I always, I always say we have our elected officials, we have institutions we can write with, we have community health programs.
Mhm.
Partnering helps. Partnering, like you said, Annmarie, about information, health fairs, all of these things matter.
I just love how you said create a health care plan together. I love that because I think that is a big problem too, is that we as patients sometimes feel as though the doctor doesn't need to, we don't need to be included because the doctor's got it under control. And that's not always, the doctor's got a lot of patients that they're seeing that day. Take charge in your health and find that doctor that wants you to be part of that, wants you to be equal and provide you. And everything you said, I agree with. Let's just add some solutions there. If I come to the doctor and I say, "Look, I got really bad back pain. You and I both have MS. We know about that pain. That lesion sits right on the base of my back. What can I do? I don't want another pill. What can I do to
Right,
ease this a little bit more?" Because that goes with equity, right? Because we want to have everything provided to us so we can succeed, and succeed is through solutions
right.
to all
It's
of
solution
this.
based. Exactly. You have to listen. We have to develop a care plan. One of the things now, and we all know about in this chronic illness community, is the lack of, or the lesser of representation for clinical trials in Black and Brown
I
communities.
just was
Those
going to say that, Teresa. You're in my brain. That's exactly what I was going to say. You're
that
100%
has
right.
to change. Yes. And again, I'm working with different organizations that I'm really, really passionate about, where we are bringing change, and we are trying to involve people in research and science, because we know this: if everyone is not included, we're not where we need to be. And one more quote from myself that I'm going to use: we are only as strong as the weakest of our community, as the most vulnerable of our communities. We are only as strong as the most vulnerable of our communities. So, like, if people all some people say all the time, well, this doesn't really affect me. So if it doesn't affect you directly, then you shouldn't have. Then does that absolve you of responsibility?
No, it does not, Teresa.
Of course.
That makes me so out of my mind because we have many issues, especially in the mental health community, with that sort of thing, because we figure it's not happening to us. Why are we dealing with this when in actuality it may not be happening directly to you, but maybe you work with somebody right? Because that person is having some mental health challenges, you can't get your work done because they're going through something. Guess what? It affects you. So I totally
Right.
and the last thing I want to add to this is I recently, a friend of mine was reading this study to me, and it was about medical marijuana and how it can lower X, Y, and Z. And I don't want to go into, because I'm not here for a clinical trial. However, they were going on and on about how great this study was. And I said, well, let me hear more about the study. Where was it done? Wherever, one country, okay? One country where the population is mostly thin people. And when I looked at, because you could obviously, if it's a clinical trial, you can pull it all up. When I looked it up, they were middle class, middle aged, white. I was like, this isn't a study. This is a study of to suburbia. Like, you are so right. It like was so plain right there. But this person doesn't deal with health issues. And when I showed them that and explained that to them, they were blown away. They couldn't believe that there weren't people of color added to this, different demographics, different blah, blah, blah. And that's part of it. Like, we read these clinical studies and, people think, oh, this is great. They did this study on blah, blah, blah. But how many people of color were added to that study? How many older people, younger people, all of that stuff. That's where we could start making a huge change. We really could.
That's where change begins. And again, this, it's not going to occur overnight. We have to take one step at a time. But the first step is acknowledging that, there needs to be a change, acknowledging that this bias and this divide exists, and, moving from there. And my takeaway or my ask is always, examine yourself. Examine yourself first, especially if you are in positions of authority and you are a healthcare provider. Examine yourself first and see what your beliefs are. And if, again, that belief is going to go toward the betterment of your patient, or if that belief can possibly prevent that patient from getting their full access to care. That's very important. Secondly, information is key, like you said.
Yep.
Partnerships, community partnerships, advocates, all of these people have their fingers on the pulses of their community. You want to see change in anywhere, you rely on that person with the knowledge. We have lived experience. So my lived experience and your medical experience and your medical expertise, what we can do together with that. But you can't tell me that just because you have this certification and you have that. See, I am the chief and I am the chief and CEO of my experience and my body.
Yeah, for
You
sure.
have to take that into account
And take charge with that. And
and take
I
charge
think,
of that.
Teresa, I think that's a perfect way to really end this conversation, because the only way to get equality and equity is to take charge in your health. And you keep saying in tune to your body and know your body. Like, that is really important. Knowing your body, being in tune to it and understanding it, so that when you go to your doctor and your provider, you are clear as a bell to what you are trying to say. And the other thing is like you said, not everyone can be a voice. So it's really important for us to be those voices so that people
Absolutely.
can understand not everything is equal right now, especially in
Absolutely.
healthcare. Teresa, thank you for all you do for Lyfebulb. You are an
Thank
amazing
you.
ambassador. I love being in your presence. I
Thank
cannot thank you
you.
enough for joining me this afternoon, and I hope you have a beautiful rest of your day.
Thank you. Take care.